The following is for informational purposes only. For medical advice, please see a medical professional.
Welcome to Staying Alive with Margaret and Susie. In this episode, we're going to talk about dental care, and that consists of our mouth, our teeth, and our gums. We know today it's an important part of healthcare because it can be a pathway to infection entering our bloodstreams, and lack of dental care can lead to serious life-threatening condition for elders, but also for younger people too, especially if they have a heart condition. Um, Historically, we didn't always know that. In our parents' generation,
Yeah,
a lot of people just didn't even go to the dentist unless they had a serious infection and needed an extraction. And
right.
extraction was a plentiful, and so it wasn't uncommon when I was a kid to know lots of older people in my family who didn't have many teeth or any teeth. And
Yeah,
in researching this, I found out that even today, 1 out of 5 people over 70 has few or none of their own teeth.
wow.
And ours is the first generation where we've really known about dental care, and also we've grown up with fluoride in toothpaste and in the water, and our kids have, and that's led to better outcomes. Like Susie, you
Mm.
were telling me your daughter grew up without cavities. Like
Yeah, she
she
had
was
never
a
had a cavity
few years
until she
young.
was an adult, actually. But
Yeah,
that's
and
another story. But yeah,
yeah.
because she had always had good dental care. Yeah.
And so, hopefully, we are of a generation where we're hoping to keep most of our teeth and
Mm-hmm.
prevent these serious health problems. And, because we know that dental disease is more common in seniors because of a combination of factors that are a normal part of aging, like normal part of aging, dry mouth, because we have reduced saliva, weaker immune systems to fight off infections, and then receding gum lines that accelerate tooth decay. And then if we have any chronic conditions on top of that, like diabetes, that also increases tooth decay, for example. So,
Right.
so Susie
Right.
and I are going to focus primarily on what you can do at home to care for your teeth and gums,
Mm-hmm.
and what we do to care for ourselves. And because getting to a dentist can be hard, it can be costly, and we're of course suggesting that you do it. But we're going to talk about access to dentistry in this
Sure.
country because it's a tough thing. Ideally, we want to go every 6 months, but we understand that some people, just for whatever reason, can't do that. So I thought we'd start by telling a little bit about our stories with dentistry and throughout our lives. And Susie and I have known each other since our 20s, so I'm dying to ask her this question. Did you go to the dentist in your 20s? Because I never went once. I never went
Boy,
once in my 20s.
I had my wisdom teeth taken out when I was probably about 20. Um, So I remember that, but I don't remember going to the dentist, to be honest with you. I don't think it became a thing till I had children and then I was, taking care of my own teeth.
And
But
that was
I
in our
don't remember.
30s. That was
Yeah,
in
I
our
don't
30s.
remember going to the dentist.
Hmm.
And
I
when I
didn't.
was a child, I didn't go to the dentist until I was 6 years old, and my brother fell down and knocked out his two front teeth. And so then we went to the dentist, and it was a horrible experience because we had cavities.
Yeah.
And I just thought
Yeah.
the dentist was the worst horrible person in the entire universe.
Yeah.
Yeah.
Well, yeah,
Yeah.
we all had cavities back then. And
Yeah.
so I didn't go at all in my 20s. I had some fillings from my young years. And so by the time I was in my 30s, I started noticing that my gums hurt really bad all the time.
Mm,
And
mm,
luckily, by my mid 30s, I finally finished college and I had a job with dental insurance and a good
mm-hmm.
dentist. And so I finally got to the dentist in my mid 30s, and because I was concerned, like, why are my gums hurting so much? And I found out that I had like pretty advanced gum disease. They measure like the pockets in your gum
Mm-hmm.
between your tooth and your gums, and my dentist said you're on the verge of needing surgery. Like
Ooh.
we might be able to turn this around if you do everything I say immediately, and then we'll reevaluate in a couple of months. And so she taught me to use a water pick, and she told me to, she said, you have to get an electric toothbrush. And at that point, there was only one on the market, and it was like $300, $400, and they
Wow.
were really expensive back then. Nobody was even using them yet. And I was like, I'd heard about gum surgery. I was like, I'll go to any lengths because as people know, like when you cut something in your mouth, it hurts bad. And so, I was willing to go to any lengths, and so I saved up my money to buy that electric toothbrush, and
Wow.
I was able to turn around the dental gum surgery and never have had to have it ever, ever, ever.
No, that's good.
And I've just like done everything that my dentist has told me to do ever since. But unfortunately, at that time, I already had one tooth. It's called your 6-year-old molar that was beyond repair, and I had to have that extracted.
Mm,
And what they told me was uh, when you lose a tooth placement in your mouth, all the teeth in your mouth move around then, and you no
mm.
longer have a proper bite, and you're greatly increased chance that you're going to lose all your teeth in your life.
Wow.
So you have to put something in the place of where that tooth was to keep your teeth in alignment. And so I went for that too. And luckily, I I had the resources to do that. And back then, it was really, really costly. Like most people get a bridge because that's
Right.
more affordable than an implant. I don't know if implants were kind of new at that time, but I got the implant, and I was like really lucky at that particular time to have the resources to do it. Because earlier in my life as a college student, I couldn't have paid for that. And later in life, when I went through job changes, I couldn't have paid for that.
Mm.
And so, yeah, I've always been really careful about my teeth, very careful. And
Yeah.
so,
I've never had a tooth pulled, but other than wisdom teeth, but
yeah.
I know people who've had a tooth pulled and sometimes they do okay, depending upon where the tooth is, to just leave it. But I know that sometimes it's not always the case. Yeah.
Hmm.
Yeah. It's hard.
So now
It's
that we're older and wiser, we do our best to take good care of our teeth. And
hmm
it's for us and as our loved ones, because as Susie reminded me, kissing someone can pass infection, or you know
It
that
sure
you have
can. I
infection in your
dental
teeth.
dental dental
It's contagious.
disease, is contagious.
Yeah.
And that's why when pregnant women get a lot of attention sometimes for their dentist care, even if they're low income, because they know that mothers can pass it on to babies by sharing food or it's typical for moms to stick a pacifier in their mouth and then pass it to the baby. Yeah, so you can also get it from kissing. Yeah,
Wow.
dental disease, because
Well,
people forget that dental disease is infection, is it's bacteria, right?
yeah.
And
Wow.
so a lot of that is was not understood for a long time. People think, oh, sugar causes cavities. Well, we'll go into that in a minute, but it's bacteria,
Yeah.
basically.
So, Susie, this is a good point to give us the science overview
Yeah.
of our mouth or and our
Well,
gums
the
and
thing
teeth.
is, yeah, the thing is about your mouth is it's part of your gut. It's the gateway to your gut. The gut is everything from your mouth to your colon and anus. So it's important to think about what you put in your mouth and how you take care of it. Recently, I discovered that some dentists are recommending that people brush their teeth before they eat breakfast in the morning. And I just thought that was so interesting. So I started looking into it. And basically, what it is that you want to, so you sleep at night, and a lot of people sleep with their mouth open. They can't help it, right? Unless they use mouth tape, but a lot of people sleep with their mouth open. And so you get some extra bacteria in there in the morning,
Mm.
right? So you've got the extra bacteria. And then, so you want to, if you brush your teeth first before you eat and remove some of that bacteria, you protect your mouth from getting more damage from eating. I mean, it doesn't make sense, but basically, you want to remove some of that bacteria, and then and that sets up a better pH for your mouth. So, fluoride toothpaste, for instance, let me read this, creates a shield protecting enamel from acids in common breakfast foods. So, you're kind of protecting the enamel, and then also freshens your breath. So you're actually kind of setting up a proper pH in your mouth by brushing your. And I know it's not in the normal routine. If you think about routines and all the routines that we have to do to keep up our health, it's not the normal routine. I've tried doing it myself, and I oftentimes forget. It's like,
Yeah.
oh, I was going to brush my teeth before I ate, but it's too late. And then if you don't do that, you should wait 30 to 60 minutes after eating for the same reason,
Hmm.
to set up the right pH for to prevent bacteria from growing. Yeah,
Well,
it's interesting,
that
isn't
sounds
it?
good. Yeah.
Yeah,
But
yeah.
sometimes I'll use my dental floss immediately, like because I have teeth that are close together, so I cannot wait on flossing. Like I'm
No, I
really.
I have the
Mhm.
opposite problem. I have a two crowns that are one is flat on one side, and
Mhm.
so it doesn't mesh with the crown behind it. So I always get food stuck there, and
Mhm.
it's too much space.
Mm.
And that it's annoying. It's annoying. But the other thing that you can do to really protect your mouth is with nutrition, because just like any part of your gut, you can help protect your mouth from the growth of extra too much bacteria. Okay, so eating the things that you're good, same things that are good for your gut, like fiber, eating things that are whole grain, fruits and vegetables, things that aren't going to stick to your teeth, like white flour sticks to your teeth.
Mhm.
Of course, sugar. Sugar is especially bad for your teeth because it's acidic,
Mhm.
and so that's where we get into trouble by eating too much sugar. Um,
Well,
so
that's interesting. I don't really eat foods that are bad for my teeth, and so I
mhm.
haven't done that brush before breakfast routine. My teeth are super clean when I go to bed at night, and but I perhaps it hasn't been an issue for me because I just really don't eat anything that's bad for my teeth.
Right, but I don't think it really matters because you don't, what it is you don't want to feed the extra bacteria that's on your teeth from when you've been asleep. So you've
Yeah.
got extra bacteria in your mouth, and you don't want to give it food to
Yeah.
feed that, even if it's not necessarily, um,
Sugar.
white flour and sugar, but there's still, you're feeding that bacteria that's on your teeth. So you
Yeah.
want to like get it in the morning, get it off. I don't think that that's true for the rest of the day, for sure. You
Hmm.
don't need to brush teeth before you eat dinner and all that. But I think because we wake up in the morning with extra bacteria, and some dentists are recommending a thing to clean your tongue as well. I actually bought one. It's kind of a horseshoe shaped metal thing that you clean your tongue with. It's a little weird, but I read a study or heard about a study that they did with people in a nursing home, and people who did that had much less chance of having pneumonia.
That's
So it just
interesting.
limits the amount of bacteria.
I do something a little
System.
different because I'm a gagger. So we'll get into the routine in a minute, but could you go on and tell us about some of these serious complications or diseases caused by oral
Well,
infections?
yeah, I
Because I
mean,
mean, that's how plaque enters our bloodstream. That's how infection enters our
Yeah.
bloodstream through our mouths.
It's really sad that sometimes people, I have a family member who ended up in the hospital more than once before they figured out that actually it was his teeth and it was causing him to have heart problems. And he just hadn't been to a dentist and he knows better, but he hadn't been to a dentist and in quite a while and ended up, finally figuring it out and now has dentures. So it can be very dangerous. And Margaret and I also have a mutual friend that his heart disease started that way and it did not have a good outcome. Yeah. So it's an infection. So if you get an infection in your mouth, it becomes systemic and it can go into your bloodstream and affect you in other parts of your body, but especially your heart. Yeah.
That reminds me, if you're a senior and you have heart condition, a lot of times your doctor will want you to take antibiotics if you're having, say, a filling done or something. And so
Right.
talk to your doctor about that because I know if I have major dental surgery, which I haven't had since I've had a heart condition, I do have to take antibiotics.
Mm-hmm.
And that reminds me, I mean, young people would never have heard of this person, but when we were kids, there was this guy who was married to Sandra Dee when she was in the movie Gidget called Bobby Darin. And he had a heart condition. And we
Oh,
found out that he died because he didn't take his antibiotics when he went to the dentist.
oh,
That was how
wow.
he died, and he was in his
Wow, how sad.
30s. And
Yeah.
and so a lot of us elders have heart conditions, and so check into that. Like if you have major dental needs,
Mm-hmm.
surgery or whatever,
Yeah, it's
talk to your
just really
doctor about
important.
getting an antibiotic.
Yeah. You know, um,
Look,
I think that it's frustrating for people too. This is a frustration. There's dentists say, it's very frustrating for them because it's a preventable disease, really. And it isn't treated necessarily as a preventable disease in many populations because of insurance limits. So that's very frustrating. Yeah.
yes, I mean, Susie and I are obviously of the politics where we believe dentistry is an important part of healthcare and it should be
Mm-hmm.
part of Medicare for
Yep.
those of us that are seniors. And
Yep.
I believe like there was a Democratic president recently who almost got that through. Like I was like,
Mm-hmm.
Keith, we're going to have dentistry paid for in our lifetime in Medicare. Of course, it didn't get through. Didn't
Yeah.
get through,
Yeah.
but we can live in hope for the day that's going to come. Like we're going to keep fighting for that, but
Yeah.
that's an outside
Yeah,
issue.
dental
So
insurance unfortunately has its limits. And for some people, it doesn't really pan out financially unless you have major work that needs to be done, but then they don't even pay for all of it. So it's very frustrating, very
yeah,
frustrating. And in
and
my community, there is a dental clinic kind of first come, first serve basis for people who are low income.
yeah, we'll come back to access. Could we talk about our daily routines?
Oh,
Do you want
sure.
to start that off, or would you like me to? I'll start it off, and then
Yeah,
you
yeah.
can decide. So, my daily routine consists of my mouth care, but it also consists of taking calcium with vitamin D every day. And
Mm,
so, I want people to know that reputable studies from the NIH have found that taking calcium with vitamin D prevents tooth loss in humans, particularly in the elderly.
right. It's all the enamel to
And
protect your enamel. Yeah.
and so my doctor has me doing that. My doctor has me taking using prescription toothpaste which is higher in fluoride, and it says it's particularly for dry mouth.
Hmm.
And my this particular physician, he's like a healthy guy in his 30s, and he said this is what I use because studies have shown that if you use this kind of toothpaste, it's going to greatly decrease any tooth loss later in your life. And so he
Mm-hmm.
said, I'm using this prescription toothpaste for life. And
Right.
And so my daily care consists of like 2 or 3 times a day. It just depends how much out of the house I am and where I am. I floss between my teeth. I keep floss with me because I need to floss between my teeth. And then I clean my mouth and teeth. I brush my teeth, and then I wash with a rinse. And talk to your doctor about mouthwashes
Mm-hmm.
and what is correct. I'm also on a prescription mouthwash,
Mm.
and that's what I use. And it's just a quick rinse to kill the necessary bacteria, but not all the bacteria.
Right. You got to be
And
careful not to overuse some of the mouthwashes that they are over the counter.
the
They're pretty strong, and so they can be too strong. And so, talk to your dentist about what is a good one to use and how
right,
often you should use it.
yeah.
You don't want to overdo it, and I don't really believe in um, using mouthwash and not brushing.
So what do you do?
What I do is I floss my teeth every night, um, and I brush my teeth, twice a day. And now I'm into cleaning my tongue, and I'm really trying to remember to do it before I eat breakfast, but
Hmm.
I'm not. And my dentist loves me. I go to the dentist twice a year, and they say, "Oh, you make our job easy. Cleaning your teeth is not that hard." I
Yeah,
have certain spots in my mouth that I know accumulate a little more plaque. So I've tried to pay a lot of attention to those spots. But I feel pretty fortunate that
yeah.
I haven't had too many problems lately. My biggest problem is probably in the last 15 years is fillings that fail or crowns that fail. These are things that, when I was younger, I thought, well, aren't those permanent?
They don't last
And
forever.
evidently
Yeah.
they're not.
No,
And
they don't.
so,
They
although my
don't.
mother, when she passed away, had a mouthful of gold crowns that she had since she was a child.
Well, that's
So,
great. That's great.
it's like, anyway,
So regarding flossing, like whether you need to do it more frequently because your teeth are really close together, like mine, or not such an issue because they're further apart, like
well,
Susie's. The
mine is a problem because things do get stuck because it's too far apart. But also, I've
well,
always thought, why don't they have medicated floss? And so then I found out they do have medicated floss. You can buy online, you can buy dental floss that has like fluoride and other compounds that dentists want you to use in the floss.
yeah.
So I thought that was interesting.
Well,
Yeah.
what I wanted to say is even if you feel that there's nothing stuck between your teeth and you don't really need to floss, it seems to be something that people are more likely to skip is the flossing,
Yeah,
is that
people
you
skip it.
keep in
I think that's
mind that
true.
the flossing, like the rubbing against the side of your tooth in between is what keeps the plaque from building up.
Yeah,
You
yeah.
can't really keep the plaque from building up between your teeth just from brushing.
Yeah,
And
it's really hard. Yeah,
and
it's really
so
hard. Yeah,
plaque breaks off and can
yeah,
also travel through the body. So Susie and I also see our dentist regularly, and if at all possible, we're hoping that people can figure out a way to save up the money to see a
yeah.
dentist at least once a
At least
year,
once a year.
at
Yeah.
least. And um, Susie, you told me a story recently where somebody said to their dentist
Oh
something
yeah, my
about
husband went to the dentist and the hygienist told me she had a patient who said, "Well, I don't brush my teeth. You clean my teeth." It's
yeah,
like, whoa,
yeah,
So I think it's really important to follow what the dentist tells you to do. Yeah, follow what the dentist tells you to do.
right.
Yeah,
And with online access, you can find that out online too. There's all kinds of reputable dental schools out there associated with
yeah,
the big medical facilities from like
yeah,
Cleveland to Harvard, Stanford. So let's talk a minute about access to dentists in the United
yeah. It's
States
very frustrating.
because if you're a senior, it's a big deal and it's very tricky. So
Mhm.
let's just talk about that for a minute.
Well, like I said, in my community, there is a clinic where people can go if they don't have money, and they can, it's kind of a first come, first served basis. Um, Unfortunately, we don't have a dental school here. I do know people who go down to the University of Washington to the dental school to get their dental work done. And we're 90 miles from there.
Yeah,
And there is a dental hygienist school here. Um, and sometimes people can go there to get their teeth cleaned.
right.
But I know it's very frustrating. There's some dentists in our community that don't even take insurance at all. Um, some are a little better about taking payments, but I know it's very difficult, and it's always been an issue. If you have a concern, talking to someone at your senior center or talking to social services, try to get a referral that way. I know it's difficult.
Yeah,
Some Medicare plans have an additional dental program that you can sign up for.
yeah,
Again, insurance has its limits. It might pay for cleaning, but if you do the math, sometimes it doesn't, it's almost like gambling. Am I
yeah,
going to am I going to need a crown? And then for crowns, it usually only pays half. So it's really hard. Yeah.
yeah. And there's one other thing that I'm aware of is that people do medical and dental tourism, and
Yeah,
so like
they do.
I had a friend who lived on the Arizona border, and I mean, maybe these days are over in our current climate. I don't know, but they got all their dental work done. They needed a lot of dental work. They got it all done in Mexico.
Yeah.
I know somebody who traveled to an ashram every year in India, and when she needed major dental work, she got all her dental work done in India.
Hmm.
I have friends who are have dual citizenship, and they go back to the country that they have dual citizenship with, where there's dental care,
Yes.
and
People here go to Canada, used to go to Canada. It was
mhm,
pretty common to go up to Canada and get your dental work. I don't know that that's true anymore. Yeah.
yeah. So
Yeah.
yeah.
Well,
So
I
I
wish
think
people could have better access. That's all there is to it. Yeah.
yeah, and we're never going to give up on living in a society where it takes excellent care of our health, and especially for our aging population,
Yeah.
and their health, our health. And so yeah, I'm glad we covered dental care. I think this
Yeah.
was good. Anything
And
else you want to tell folks?
I don't think so, but we were going to remember to say,
Yeah. Like, subscribe, or follow, and leave a comment.
yeah, yeah,
Yes,
yeah. Check out
that
our
helps.
website.
That
It's
helps
Staying
in some
Alive.
way that we don't even understand, but we were told to say that. Yeah.
We have
So
technical people to help us with that stuff.
yeah, that's so. Until next time, Susie,
We
we
are
are staying
staying alive.
alive.
You've been listening to Staying Alive with Margaret and Susie. This show is hosted by Margaret Cooley and Susie Hymas. To subscribe to our show, leave a comment or ask a question, please visit stayingalivewithmargaretandsusie.com. Our podcast is available on all major podcast platforms. If you've enjoyed our program, please feel free to leave us a 5-star review. Thanks for listening.